ladies, how are you doing? So today is for the ladies, but also for the gentlemen who want to help their ladies, for the gentlemen who want to be supportive and just be there for their women during that time of the month. So today I'm talking about our menstruals, that time of the month when we have our menstruals. So have you ever been to the doctors time and time again, over and over again, because you're having one, severe cramps, and two, you're having irregularities with your period, in that 1 week, one month it's the periods take 1 week, and then the next month you have periods for 2 weeks, and then the other month you have periods for like 3 days, and they are done, and you're like, whoa, this also happens. So I've been there before. I've been down that route before. I visited a gynecologist at Wandega. There's a very nice clinic down, so at Wandega. I won't say the name because I know someone's business, but yeah, they weren't bad as such, but still. So I would go there to see a gynecologist because of irregularities that I had with my period, and also the extra pain that would come with my period. But over time, I realized that I'm not willing to continue with the medication. That is one. I hated it, because 1 month I would be fine and the next time not. And then secondly, I realized that I could have things that I can do at home that don't necessitate me to go to a doctor's. So first and foremost, what did I do for the extreme cramps? Ladies, it's normal to have cramps, yes, but there are cramps that are extreme. That is what I want to make clear. The cramps you get when you can't move, those cramps when you literally are crawling and you can't walk, those cramps that just make tears flow out and you can't talk, you don't even have the strength to talk. Those are abnormal cramps. And in my case, because at some point maybe I get tired of medicine and things like that, I had to look for other ways. So first and foremost, when I have such cramps, what do I do, or what does someone who is with me do for me? Because there are cases where I can't help myself. I can't do what I'm supposed to do by myself. So what happens is that the person who is with me, or if I'm able to, one, I have a hot water bottle with me that I put on my lower abdomen, just that part of my body that is feeling the most pain. So what happens is that you put hot water in a bottle, and you want to go ahead and put the bottle on that area so that it generates heat and it helps with the blood flow. That is first and foremost. Secondly, what you can do, or what the other person can do for you, is to squeeze out a towel in hot water. Put the towel in hot water, squeeze it out, press that part that is feeling the pain. That really helps a lot in terms of relieving cramps. Then also, you want to keep away from cold drinks, from anything cold, be it cold food. You just want to keep away from it. And for drinks, especially when maybe you feel like you really want something cold, Bambi, just try as much as possible to keep to room temperature. Avoid refrigerated things. We love cold things, they're just out of the freezer and things like that. But refrigerated things sometimes do trigger our cramps to increase and things like that. So you just want to keep having things at room temperature, and maybe you also want to just keep having warm water with you. Have warm water. And maybe the other important thing is, when you're having that warm water or that hot water, you've put it in a cup and you're going to drink it, squeeze a lemon in it. Just get a lemon and just squeeze maybe half a lemon into the cup of warm water that you're going to take. And for those who have ginger at home, smash your ginger and just put it into the hot water so that you drink that, because ginger helps a lot. You know, it has components in it that helps to release, to you know, just help to relieve the pain, the menstrual pain. That is the thing about ginger and lemon. And then also the other thing that I would really advise one to do is pay attention to everything that triggers you. Sometimes you're having mild cramps and then you smell something and your cramps go crazy. Sometimes you're not even having cramps, but you're seated and maybe someone passes by with a perfume and you feel nausea, or even go as far as throwing up. So it's really important to notice what triggers us. Sometimes certain odors could trigger the cramps to increase, or could even trigger nausea and throwing up itself, not just it being nausea. And then what you want to do in such cases, when you know what triggers you, try to avoid it, try to keep away from it. And then of course the very important thing that I would like to say is that, ladies, always alert someone. Tell someone you're not okay. Tell someone you're on your period, so that they can come and rescue you at that point when you can't pick up a phone call, when you can't. Just tell them, I'm on my period. If you call me 2 to 3 times and I'm not picking, rush to my place and save me, sister, because I'll be dying. Rush to my place and help me out, because sometimes we have severe cramps and we might pass out due to pain, or sometimes we could you know, try to do something and you know, you get a cramp attack and you can't help yourself anymore and you're down and you just need someone to come and check on you. You just need someone to come and be there with you, especially for those who do stay alone. Ladies, alert someone, tell someone you're not okay, so that they know what to do when they see you in such a situation or when something happens. And then that brings me to the fact that we need to speak up. We need to stop being shy about our period. Periods are normal. Periods are what makes us who we are. If you're not a woman, if you're a woman and you're in a position where you miss your period, you know, you're worried, you're wondering, am I pregnant, what's going on, especially when you know you're not on menopause, you know, it's not yet, you know, time for you to be having menopause. So periods make us who we are, and they are part of us, and we need to stop being shy about them, because they are part of who we are. And people need to respect that periods are normal, and people need to respect that periods are part of women, and it's normal for a woman to menstruate. It can happen to her that she'll stand up and she'll find her skirt stained. Help her sister out, help her out, you know, give her cloth to cover herself, be it a coat, be it for us here in Africa we have lesus. Give her lesu, you know, help her change, because they are part of who we are. It's who we are. Periods are part of us, and we need to acknowledge them, and people need to know that during that time we are vulnerable. Some people I know, you know, they are just an emotional wreck, an emotional mess when they're on their period. And so for us to just be supportive and be there for people during those days is really important, because it's part of who we are as women. And so fellow women, let us stand up for each other. And the other great tip that I want us to know is that, ladies, please always walk with a pad in your bag, especially when it's almost that time of the month, for those who keep track. And then for those who, you know, don't usually keep track and things like that, just keep a pad in your bag, you know, a small pad. Just carry it, wrap it in tissue, and put it in your bag, because it will save you. And when it can't save you, it will save someone else who will, have a stain, because either they are having an overflow, or they didn't prepare for it. And then the other thing I wanted to talk about that I think is really important is for us to recognize how we react to pads, how our bodies react to pads. For those who are using pads, I don't do tampons, so I can't give advice on that. But for those who do, please let us know how those work and how you found them. But for us using pads, let us really be sure to double check. Sometimes you use a pad and you find that it has burnt your whole skin, like that part of your body is where the pad has settled is burnt, or you have a rash, just like children, babies get diaper rash. Even women do get rash from pads. So we need to be sensitive to what kind of pads we are using. It really helps us out, and it helps us to know what products to use and what products to avoid. Personally, there's a product that everyone uses and is all over the place, but I don't use, because once it's on my body, I know that I will have I'll get burnt. My skin will get burnt, and I'll you're on your period, you're nursing wounds. I mean, that's a lot of trouble that you just want to avoid. So it's better you just pay attention to product and how your body reacts to it, so that you can know which product is best for you to use during your period. That is in terms of the sanitary towels, which are the pads. So that is it, guys. Thank you so much. Thank you for joining me today. I love you so much, and take care. Bye.